Hi, I'm Dr. Ken Brown, a gastroenterologist in Plano, Texas. If you're watching this video, you may be having some issues with hemorrhoids. It's actually one of the most common things that I treat in the office. In fact, over half the people over the age of 50 will actually have problematic hemorrhoids. Now, it's kind of an embarrassing topic for some people, but the reality is that everybody has hemorrhoids. They're a normal anatomic structure. All hemorrhoids are blood vessels that are in the lower rectum where the anus is. There's two types of hemorrhoids, internal hemorrhoids and external hemorrhoids. What happens is these hemorrhoids are actually useful because they work like a shock absorber or a cushion when we go to the restroom. The problem is, if the hemorrhoids get filled with blood, two different things can go on. You can have an external hemorrhoid, which hurts very bad, and internal hemorrhoids, which don't hurt, but they cause other symptoms, such as bleeding, itching, incomplete evacuation, trouble cleaning yourself after using the restroom, and they can even get so big that they'll come out of the anus, and we call that prolapsing hemorrhoids. The next question everybody asks is, what are the causes of hemorrhoids? Now, hemorrhoids can be caused by a lot of different things, but the most common causes include constipation, straining, using the restroom frequently, heavy lifting, and pregnancy are the 5 most common causes of hemorrhoids. There are a few others, but this is what most of my patients actually develop their hemorrhoids from. So if you do have bothersome hemorrhoids, I'd like to talk about a few of the treatments that are out there. First thing I always try with all my patients, let's try the conservative route. Let's start by changing your diet and seeing if we can increase the fiber. If you increase the fiber, your stool becomes a little bit easier to evacuate and you have less constipation and straining. If that doesn't work, a lot of times people will try the over-the-counter remedies, such as Preparation H. Unfortunately, those are just there to help with some of the symptoms. They actually don't take care of the hemorrhoids at all. It will help with a little bit of itching, and we don't recommend using any of those creams for longer than a week. So if you still have hemorrhoids after trying some of the conservative treatments, that's when you come in to see a doctor like me. There are 3 minimally invasive options, which most doctors do now, and the very invasive one, which is a surgical hemorrhoidectomy. My goal is to prevent you from actually needing surgery on your hemorrhoids. So I'm going to focus on these 3 different non-invasive ways. The first one that a lot of patients have seen out there is called IRC. IRC is the infrared coagulation. What that does is that coagulates the blood vessels of the hemorrhoids. Now, the problem with that is that it actually is not very effective. It's been shown to only help people with really small hemorrhoids, and they do tend to come back. The benefit is it's completely painless. And then there's the traditional hemorrhoid banding, which has been around for a long time. Traditional hemorrhoid banding is where the hemorrhoid itself is grasped and then a band is placed on the hemorrhoid directly. This is pretty effective for helping hemorrhoids. The problem is it can be extremely painful. And the reason is when this hemorrhoid is banded, it's near the dentate line. When we go below the dentate line, it's extremely painful. Above the dentate line, there are no pain fibers. The method that I do is actually a modified banding technique. I actually go up above the dentate line where there are no pain fibers, place a small rubber band, and that causes a little ulcer that ultimately forms into a scar. That scar prevents the blood flow from returning to that hemorrhoid. I found that this particular method is the most effective, least painful, and safest way to actually get rid of hemorrhoids. To learn more about hemorrhoids, symptoms, causes, and treatments, please read the rest of the hemorrhoid content that I have on this page, which does cover everything else in a little bit more detail. If you have any issues with your hemorrhoids, please click on the link or go ahead and call our office. We'll try to get you in as quickly as possible. Thank you.